Well, I would like to welcome our audience to this high-level webinar, during which we will try to answer the question why African countries are calling for drug policy reform. This webinar is an extension of yesterday's webinar, which was devoted exactly to the same thematic, and which discussed policies implemented in different regions, particularly in Latin America, Asia, and Africa. Our focus today is on Africa, a continent experiencing security and development challenges, exacerbated by external interference, climate change, radicalism, separatism, and drug trafficking, among others. The call for reforms suppose first taking stock of the reality on the ground to establish the causes of the failure of current drug policies. Two, the challenges of shifting to new approaches both at the national level and at the regional level. Three, the requirement of a comprehensive health-oriented drug policy that will include and involve civil society in shaping such new policy, and to exchange thoughts and views on the reasons underpinning the persistent call for reform to address the scourge of drugs. The Policy Center of the New South solicited the participation of a very eminent panel composed of 2 members of the Global Commission on Drug Policy, a member of the West African Commission on Drugs, and an experienced analyst and lecturer on the issue of drugs. Let me, in a nutshell, make a very subjective and very brief presentation of our respective panelists. Mrs. Mary Chinri Hess served in different countries as resident coordinator of UNDP. She was the first woman Deputy Director General of the International Labour Organization, Chief Advisor of the President of the Republic of Ghana, and she currently serves as one of the 5 members African Union panel of the WISE and Commissioner of the West African Commission on Drugs. Ustad Mohammed Al-Baradei, who doesn't need presentations, after serving in different capacities in the International Agency for Atomic Energy, he became Director General of the institution for 12 years, from 1997 to 2009, and he was jointly awarded with the institution the Nobel Prize. From 1974 to 1978, Mr. Baradei was a special assistant to the Foreign Minister of Egypt, and in this capacity he was part of the team that negotiated the disengagement agreement between Israel and Egypt. Mr. Baradei holds a doctorate in international law from New York University School of Law, where he also lectures. President Motlanthe Kgalema served as Deputy President of South Africa 2009 to 14, and President of the country from 2008 to 9, and also served as Deputy President of the country's ruling party, the African National Congress, 2007 to 12. Mr. Motlanthe was politically active from an early age. He was sentenced to a term of 10 years at Robben Island, where the late President Nelson Mandela had been incarcerated. In 1997, President Motlanthe was elected Secretary General of the ANC, and in December 2007, Deputy President of the ANC and Minister without portfolio in July 2008. Si Khalid Tinasti is a visiting lecturer at the Graduate Institute of Geneva, teaching international drug policy governance, and a visiting fellow at the International Center on Drug Policy Studies at the University of Shanghai 2020 to 22. He was Director, Executive Secretary, and Policy Analyst at the Global Commission of Drug Policy. Si Khalid holds a PhD in Political Science from l'Institut Catholique de Paris. I know I hope that you will not hold it against me. I know that I didn't do justice to your long and prestigious career, but if you have to blame me. Let me begin our discussions. And I think we have all be reminded that we will do our utmost to be as concise and brief as possible. To put us in the picture about the global trend in our continent, I would like to call upon Mr. Khalid Tinesti for a very concise overview of the current pressing issues in drug control in Africa and the immediate upcoming challenges that we are facing. Please, Khalid, you have the floor.
Thank you very much, Mr. Ambassador, and I'm very, very honored to be part of this panel and this high-level panel. So just to go very briefly to the question, in general terms, what we know from the reported data that out of the 269 million people who use drugs that were reported in 2018, this is the latest data, 60 million of people who use drugs live in the African continent. And this is very, very partial because only 11 countries have reported their data to the UN Office on Drugs and Crime that does collect it and then share it with the world. So consumption is going up. It's increasing throughout the years for the last 20 years since data collection has been ongoing at the global level. In terms of trafficking, so there are new trends into a new cocaine routes that come in through the West African countries. And as we know, and I think that Dr. Marichineri Hesse will speak about it more in terms of what the West Africa Commission does, but it is a new route that goes cocaine from south to north, cannabis from north to south, and methamphetamine labs and local production of different substances such as cannabis, etc. We also have now a new trafficking route that is developing through the Indian Ocean for concerning eastern and southern coasts of the continent. And Mr. President will certainly also speak more articulately about this than I would. But and in terms of production, of course, throughout the continent, there has been historical and traditional production of plants such as cannabis, such as opium poppies, as reported, for example, in the Sinai and in Egypt, and of course the med labs. And in terms of public health, there are issues with the HIV transmission and injection. There are overdoses that are increasing in terms of diverted opioids. And of course, the big issue also is prison overcrowding, with some countries that have over 600% capacity overcrowded in some prisons in the region and in West Africa itself. Just two caveats on this issue. The first one is that the data is very, very limited. So it gives us just a very small picture of what is happening. Just a small example, we think, so the UN tells us that between now and 2030, there's going to be 18 million new consumers in Africa based just on the demographic increase. But that is used really to raise fear and not addressing at the same time that there are the services such as harm reduction services, evidence-based treatment, prevention that could be put in place. What is the kind of capacity, institutional, judicial capacity that is being built to respond to this upcoming challenge of increasing use that happens all over the world, but that would concern Africa specifically because of its demographic increase in the upcoming years. There's also the fact that we need to remember that in a policy discussion, it is very, very hard to convey or not understate the impact of current policies on people's lives. For example, as the late Kofi Annan used to say, what is more dangerous for youth? Is it a criminal record that would follow them all their lives, or is it simply, or is it occasional use of drugs that is illegal? So it is also very hard to convey the ripple effect when you are touched by the system on people's lives on the ground. So how much as we speak about it, this is something that touches upon communities, about families, lives, etc. So just to end this long response, just very briefly on two upcoming key challenges as I would see them. I would say that the one most pressing, the ignored discussion that concerns our continent more than anywhere else is the access to controlled medicines for pain relief and for palliative care. So those are about 12 substances that are classified as illegal drugs in the schedules of the drug conventions, but that are also on the list of essential medicines of WHO that people in pain should be able to receive. And they're used also for anesthesia, for mental health, et cetera, et cetera. Nevertheless, so it is the continent where the access is the least around the world. So just for morphine, for example, we know that 50% of the 50% of the world population that lives in the poorest countries has access to 1% of the existing morphine per year. And even within Africa, a country like Uganda, who has started their program in 1993 and have one of the best programs, there's morphine available, for example, about 11% coverage of the total needs. In Nigeria, we're still at less than 1%. So this is one issue that absolutely needs to be discussed. And in many, many places, the only pain relief that is available is mild opioids like tramadol. And there's also a huge debate around its scheduling because of its diversion to the illegal market. But that is a whole another debate that we can keep for another time. The only other issue, finally that I would say is to what the also West Africa Commission has been saying is to avoid the war on drug mentality and to militarize the response, but to really focus on building governance capacities, on building institutions, anti-corruption, anti-money laundering responses, to giving different responses to different levels within the criminal chain or within the drug chain. So for consumers, for low-level actors, for higher actors, and to really look into it from a very large perspective and not just go to the easy response of let's send a very heavy response to them and let's focus on organized crime. Thank you very much.
Thank you for taking only 2 extra minutes. Now, let me turn to our distinguished panelists. Given the growing perception of the failure of the war on drugs, the debate on how to respond most effectively to the drug challenge is opened at the country level and at the institutional level through the Regional Economic Commission and through the African Union. Your voices have not gone unnoticed in this discussion as former major figures in your countries, in Africa and globally. What can each one of you tell us about the problems identified and the solution recommended, and could you share with us your assessment of the current situation and the future perspectives? So you see, there are 4 questions in one. I will begin by President Motlanthe. Please go ahead.
Thank you very much for the invitation to participate in this webinar. The first point I would like to make is that Africa has become a significant transit zone for transnational organized crime and an essential route in the global illegal drug market during the last decade or so. And that consumption on the African continent is currently estimated at over $100 million US, and that drug policies, generally speaking, across the continent continue to be very repressive, and most African countries still have very harsh penalties for drug-related offenses, including the non-violent ones. And also that there is widespread marginalization and treatment of people who use drugs as criminals, as morally decrepit and weak addicts and social outcasts, while non-violent, low-level drug offenders generally make up the largest share of those sent to the criminal justice system. So it's estimated that about a third of the prison population on the continent it comes from low-level users of one drug or the other. And so the response to drug use is excessive and disproportional and often lead to human rights abuses. And of course, the governments tend to divert resources and allocate major resources towards the law enforcement efforts, and in spite of all these efforts, the trafficking, consumption, and illegal substances is on the rise. It's not decreasing, and these are resources, scarce resources that are diverted away from basic needs. And criminalization of drug use contributes to the increase of the hold and power of criminal syndicates on vulnerable sections of the population who are, whose livelihoods depend on these substances. Added to this burden is the international drug control system, which has a very negative impact, as Khalid has already alluded. When it comes to access to essential controlled medicines such as analgesics and pain treatment, we find that it is also noteworthy to remember that only 0.5% of morphine equivalent opioids are distributed in the low-income countries, which are in the main found on the African continent. So this international drug control regime has led to deprivation of pain medication, mostly because of constant fear of diversion to the black market. And of course, depriving ordinary people in pain, including children, of readily available medication is a cruel consequence of prohibition. So prohibition is one of the problems that we need as a community of nations deal with. So other consequences, of course, are that, there's over-incarceration and overcrowded prisons, which leads to more HIV transmission and pain and poverty. However, this is not the complete story. This is not the story of a bleak house. There are signs of baby steps being taken into the right direction. For instance, in the year 2019, member states adopted the new African Union Plan of Action on Drugs. And for the first time, the terms such as harm reduction, alternatives to punishment, and the need to engage civil society were explicitly included in the document, which encouraged the review of national drug laws. And we've also noted that harm reduction services for people who use drugs have been introduced in Cote d'Ivoire, in Kenya, in Mali, in Mozambique, in Mauritius, in Morocco, in Seychelles, in Senegal, in Sierra Leone, in Tanzania, in South Africa, and in Uganda. So cannabis regulation in a number of countries has been softened to either allow for it to be used for medicinal purposes, or even private use in private spaces. that is in itself an indication of positive steps being taken on the continent. And of course, there are ongoing discussions in other countries like Sierra Leone and Zimbabwe on how to review their drug policies. In 2020, Ghana introduced the first decriminalization model for drug use and possession in Africa. That in itself is a beacon and a sign of progress, which needs to be emulated by other African countries. Let me stop there so that I don't take more than the allocated 2 minutes.
President, I move very quickly to Mrs. Mary Cheney Hess. Please go ahead.
Yeah, thank you very much, and to also express my appreciation that the voice of an African woman is being added to this particular debate.
It has not been added. It is in the center.
Yeah, because it turns out that there is an important gender component, at least in Africa, when we discuss drugs, in that the same kinds of treatment is meted to the, let me call it, the drug community, which doesn't see the special needs of women. I've had cause to be involved in some discussions which focused on this issue, and I'm just putting it on the table so that we try and integrate it as much as possible. And I'm addressing this to you, Khalid, because you make such a brilliant presentation that you do not refer to the special impact on women. So this is for next time. But having said that, Mr. President, let me say that you really have made my job very easy. Your summation of the situation in Africa is so perfect and so comprehensive. And in a nutshell, you really have left me with very little to add. I agree with everything that you have said. And I just want to draw attention to one particular fact, which was also emphasized by you, Ali, that as a report that is of the West African Commission on Drugs put out as title, said no longer in transit, because it is true now that it's not just the fact of, especially the west coast of Africa, etc., being transit points, but that a lot of the drugs are really staying on. And so it's important to emphasize this as well, the change in the nature of the trade. And what we say is as other areas, maybe with greater capacity, have managed to tighten up and so on, a lot of attention is now focused on us in Africa in terms of the transit trade, in addition to the consumption, which is also increasing, and this has to be taken into account. So for a start, that already tells me that there's a lot of work to be done in tightening up systems to be able to discuss the issue of drugs at all in West Africa, which is what, as it were, encouraged His Excellency Kofi Annan late to establish this commission. The commission was put together in a manner that would enable better advocacy, so that the new information coming out of the global system in terms of the best way of handling drugs can be brought to the attention of leadership in Africa. It should not be a tangential thing, but an integral part of management of countries. And so what he emphasized then was the capacity of the people he would put on the commission to be able to open doors and to get a hearing at a very high level. And he put President Obasanjo as chair, who, as we know, is very forceful. He's a big man in Africa. So it has been good having him as chair. But in addition, we had another president, President Pires, who was on the commission, as was late Adam Kojo, who was Prime Minister of Togo, etc. But we had a very important judge as member. We also had a musician, some people who could reach out to the younger population, because I think so far the voice of youth has been muted in the discussions which we have been having globally. And I think truly there's a lot we can pick out from them, from the ground, which will enable a better packaging of how to handle this matter. So I just want to refer to that as well. The other thing which the Commission really noted was the emotional handling of the subject matter within the context of Africa. I guess this is not a problem in many areas, but if I take my country, Ghana, even the way we describe drugs, we say it's the tobacco of the devil. And this then has meant that there has been lack of looking at the data which would be relevant to taking sane decisions in this area. It's just an emotional approach. For example, we have found that many African governments, when they send reports, say even within the context of the Millennium Goals, would not talk about drugs. It's because it's in quote marks taboo. Because of the stigmatization that maybe they will lose votes, I don't know. So the Commission realized that there was need for a lot more advocacy, and that has not gone anywhere. We have to continue to push this as much as possible so that governments will feel free. And we want, in this respect, to really commend the African governments who have had the courage to move beyond rhetoric to actual integration in law. And Mr. President, Your Excellency, you referred to Ghana, where we actually have got out a law like this. That also concerned us. And what we tried to do as the West African Commission on Drugs was to bring out a template which would enable governments to facilitate the work of governments as they try to integrate the issue of drugs in law. And I think this is one of the most important outcomes of the West African Commission. I could go on more, but as I say, President, you've done a lot of my work for us, and I don't want to take up too much time, but later on, we got so much to say. And I want to commend those who put this meeting together. We should have a lot more meetings of this nature, and encourage the presentation of relevant data, which will mean that we move away from the emotional management of the issue in Africa and really present scientific facts and so on, which will enable governments to see how important it is to centralize this discussion on drugs, to improve the management of the sector in our countries, to move away from this war on drugs approach, and to see the impact of the whole drug issue on governance within especially our sub-region. I'm sure you've heard, well, you must have heard of the attempted coup in Guinea-Bissau, pushed by the drug trade. And what happened this time is mild. So though they set out to assassinate the president, we've actually had a president of Guinea-Bissau slaughtered in front of the family, with his body chopped into little bits like kebab, and so on. So just to say that we really need to give a lot of attention to this matter, and therefore I really value the kinds of intervention we are having this time. We are undermining our economies, etc., by having groups with a lot of money come and manipulate the system. You know, development of black market in this area, corruption of the judiciary, of the police. It's not only state capture you can have economically. I think drugs lead us also into a form of state capture, which we have to focus on. I'll stop here. Thank you.
Thank you, Mrs. Mary. And I could very quickly move to Dr. Brade. Your take, please.
Thank you very much, Ambassador Lulishki. And it's a pleasure to be with you today. And I thank you also for taking the initiative to organize this webinar. We are in Africa a victim of a global mismanagement of a risk. I mean, we have been for 50 years living under the illusion that there is a risk and we're going to get rid of it. You know, the war on drugs has been a total failure, but the whole system has been based on this illusion that drugs can be abolished, can be prohibited. It didn't work. The problem with Africa that we are at the tail end of a global problem, but we are suffering more than anybody else. Why? Because we are poor. Because we don't have, you know, the infrastructure or the ability to deal with it as they deal with it, say, in Europe right now, or in the US, for example. I think it's a major issue we need to decide. And it's a question of mindset. Are we treating these people as criminals, lock them in, put them in prison, or as we treat them as human beings who have health rights, development rights? This is the fundamental issue we need to answer. All the evidence tell us that they're not criminals, that this is not a crime, that they are addicted, that they need our help. We need to give them respect. We need to give them access to health. And we're not doing that. What is happening now? Are we saying, lock them in, you know, put them in prison, you know? But what is the result? And I'm talking about Africa. 1/3 of the people in prisons are drug-related, that they have the most infection of HIV, of tuberculosis, of all the sort of things that they should not have, that they have no access, as Khaled said, to pain treatment. This is inhumane. This is inhumane and inhuman, that in Africa, people have no access for pain treatment. That is, so if we want to deal with it, we just need completely to change our mindset, saying, these are not criminal people. This part of society, they need the right to have a life. They need the right to have decent. We need to help them, and we need to give them access to science. That's what I'll talk about it later about the Global Commission. We work on evidence. We saw a policy that is not working, and we're saying we need an alternative. So we need to soon, you know, and when we talk about Africa, I think that the African Union should take the initiative. I don't think this is an issue for each single country to work on it on its own. We need to have a common policy for Africa. Basically started from saying, this is something has to do with our economic and social development. This touches on every aspect of our economic and social development. We need to develop an African policy. We talk about always that we are a young continent. Maybe we are young, we have the ability to different direction from the old and failed system. So basically, I would say we need a change of mindset. We need to treat people with respect as human beings. We need to develop a common for Africa. I stop for now.
Well, thank you, Dr. Bradley. You stop at that, but I'm going to stay with you for the second leg of the questions. In your capacity as member of this Global Commission, you touched upon some aspects, and we want to have maybe more elements from this, from the work of this Global Commission. The establishment of this commission a decade ago helped trigger a global debate on drugs with very important and prestigious world leaders calling for the end of the war on drugs. Can you, in addition to what you have just said, elaborate a little bit on what the Global Commission positions, where it stands now?
Sure. I mean, the Global Commission, as we are like 25, more or less, global leaders or former heads of government or the states, and who got together and realized that we have a problem of our hand. It started with President Cardoso of Brazil, where Latin America and had the most problem in Colombia and Brazil, and realized that the policy, the so-called global policy, is kaput. It doesn't work. So let us get together and try to see what is the alternative. And the alternative was so obvious to us. One, the current policy is a failure. B, that we should not treat these people as criminal. We should delegitimize, we should decriminalize the use of drugs, particularly cannabis, and we should create the market and not leave it as crimes who now have a business of $500 billion, $500 billion. But we're leaving it. The states are leaving it to the organized crime. So our priority right now, decriminalize the use of drugs, focus on the health of the people who are using it, use harm reduction, that we should them the help clean consumption rooms, come to their help as human beings, and then of course hit hard on the organized crime. I think that's what, and then get the state control of them as they do with tobacco, as they do with alcohol. The state should be in charge and not the criminals. So our policy is easy to explain. Our policy now, priority, decriminalize the use. Decriminalize the use of not criminals. So don't lock them in, but work with them, help them, provide them with the health system, provide them with the tools they need to become an active members of society. Decriminalize, health center policy on the organized crime, and get the state to regulate the market and not leave it for the criminal. That is basically a summary, Mr. Ambassador, of our policy right now. Swimming again is a tide, I must say. The wisdom is still that this is the criminal bunch, let them put them in prison. And we are standing saying, no, our evidence does not tell us that. Our scientific data is completely contradictory to what you are doing. And slowly we are seeing a change. We see now, as Mary mentioned, when we see Thailand, when we see Switzerland, when we see Uruguay, decriminalizing doesn't mean that, you know, when we say decriminalize, it doesn't mean that we encourage people to say smoke or whatever. No. We, you know, and depending on whatever the risk, another thing I forgot also is the question of get WHO involved. WHO should be the center of the risk assessment of drugs, not the drug in Vienna. It's a health people. It's a health people who should be in charge. They should tell us the degree of risk, should tell us how to.
Thank you, Ustad Vrade. I'm going to move from one member of the Global Commission to another member of the Global Commission. And I will ask President Motlanthe to tell us about the situation in the Southern and Eastern Africa region.
Thank you once again for the opportunity to share with you our own perspectives in the Eastern and Southern Africa. Now, since the 1990s, the heroin trade routes from Afghanistan have shifted down the east coast of Africa, resulting in increased availability and a threefold reduction in the price of heroin. As we speak, the eastern coast of Africa is awash with heroin. And we have seen in the past year, 2 years or so, how unprecedented violence was unleashed in the northern parts of Mozambique, in Cabo Delgado, and basically drug syndicates with bags and bags and truckloads of money going in there to try and corrupt the institutions and the systems in a manner which is very, it almost mirrors what happened in Guinea-Bissau. And President Chisano, who is a member of our regional commission, shared with us because he had first-hand reading of the situation. And he says these syndicates beheaded 25 young people just to instill fear in the community. Their primary aim being to take control of the local municipalities so that they can then open a thoroughfare into the inner countries such as South Africa and Zimbabwe. And so in terms of the Global Commission approach, the emphasis is that we should put people's health at the center of, and safety at the center of all of our efforts. And of course, as we all know, we have porous borders because we are essentially one and the same people. You find the same communities cut right down the middle by the borders which were decided at the Berlin Conference. So movement of people across these borders easy. But the impact of drug trafficking, which is accompanied by violence and human trafficking and all other vices, leads to responses that give rise to xenophobic tendencies. Africans begin to say, these problems are imported by Africans who come from the other side of the border. And we find that when it comes to sport, these are the same people who hero worship football stars who come from neighboring countries. And yet they want to blame these criminal activities on brothers who come from sister countries on the continent. So in the short term, we're suggesting that we need to focus the response on organized crime and ensure that we decriminalize drug use and introduce alternatives to punishment for low, non-violent stakeholders and who are, participating in this illegal market. Because we've found that in spite of the fact that of all the psychoactive substances, alcohol is the most dangerous. But alcohol is legalized, it's not prohibited. And so if there's someone who, is always on the wrong side of sobriety and using alcohol, such a person is not afraid nor inhibited from asking for help from family members. If he feels thirsty, there's no problem in saying, well, can you organize a beer or two for me? But because drug use is prohibited and criminalized, and a member of the family who uses drugs, even at a moderate level, is afraid to ask for help, and this is the negative impact of this prohibition of drugs, and that is why and criminalization, and that's why we're calling for it in the short term to be decriminalized. And of course, we need in the short term to also urgently increase access to controlled essential medicines in the global south, because there are many, many people who suffer in pain simply because they have no access to essential controlled medicines. And then, of course, in terms of drug policy, we take the view that drug policy is, in fact, cross-cutting when it comes to the SDGs. The key SDGs on poverty reduction, health promotion, inclusive societies, environment protection, human rights, access to justice, and more. These are SDGs which are impacted upon by the drug policy. So prohibitionist policies create negative consequences and are counterproductive in terms of achieving the SDGs. So we need a holistic approach as part of national sustainable development strategies. The Millennium Development Goal have HIV transmissions by 2015 among people who inject drugs was not only largely missed, but there was 30% increase in HIV infections through the drug injection. So we must guard against repeating these same mistakes. And that's been our clarion call, that we need to buckle down to reviewing policy and ensuring that we move towards a new international drug control framework based on evidence. And that way we believe that the repressive side of the response can then be moderated. Yeah. Thank you. Let me pause there.
Thank you, President Motlanthe. Earlier, Dr. Mary Cheney has seconded what the President Motlanthe said, and she expressed implicitly the wish to have the opportunity to elaborate more. So I'm giving her now the opportunity to elaborate, and I would like her to tell us how is the region doing, how is the West African region doing in terms of drug policy in her capacity as member of the West African Commission on Drugs, an initiative that all we know we owe it to the late Secretary General Kofi Annan, one of the most respected African leaders of our time. Please go ahead, Dr. Mary.
Thank you very much, sir. And Mr. President, to say also that a lot of what you said applies also to the West African region. And that tells me that the proposal made that maybe is at the level of the African Union also, where a lot of action still needs to be taken. This should be taken seriously. There should be a lot more sharing of information, not only among people like ourselves who are already familiar with the thematic area, but generally, so that the point which has been made about this whole policy area being treated in a cross-cutting manner, comprehensively with other issues should also be taken into account. Because we're dealing with individuals whose lives are touched so badly wherever you look. We emphasized, Mohammed, you emphasized very much the health component, where WHO really should take its responsibility more seriously. I think this is something which we need to push. It's not that they're not doing anything, but it's not on the front burner, we can say so. And looking at the way in which this particular issue of drugs is affecting at least societies in our area, shows that it has to be given greater priority than has happened. Of course, we know the African Union is also trying to work in this area. We now have more activity, but it's not enough. And advocacy, which we have limited at the level of leadership within countries, I think should also be addressed specifically at the African Union, so that we can even have a summit decision coming out to help us to focus attention on truly treating this topic, not just as in rhetoric, but that we see action. I can say, for example, that for the ECOWAS region, because of our advocacy, there was a decision actually taken to block 1.2% or so of GDP for drug treatment. It was just a decision like many others, and nothing has happened. But that tells me that at least there's a basis for pushing, so that when we talk about harm reduction, especially, it will be a serious discussion. We talk about it, we do not have the facilities to handle the problem, and we continue to put all the money in issues of decriminalization, etc. I think we need to look seriously at the possibility of taking a decision that the money taken from drug barons will be used to improve harm reduction capacities within the continent, so that we will not just be saying it and then nothing happens. There's a lot of work which needs to be done in this regard. And as I say, the only way to really get full attention is if we could push the AU into a position where it will be an agenda item within the context one of the summits and so on. It's really necessary to do that. And I think myself that the other matter, at least looking at West Africa, which is becoming bigger and bigger, relates to the issue of livelihood of families in rural areas and so on, who truly could be made to have a better quality of life by regulating the sector. Cannabis is normally lumped with cocaine when we debate. But once you do this, we lose the livelihood impact of cannabis and its growth, etc., in terms of poverty reduction. What we have tried to do in Ghana is to make the distinction and to try now to bring out regulations which will enable those who treat it as an agricultural program. I'm talking about cannabis, to be able to have the kind of regulation, but also support to enable them to capture markets, etc. And also not to get, not to abuse the system or to start to criminalize the situation even further. They need help, and we're trying to bring out laws in this regard. We currently in the process of doing this in Ghana, and this should be of great help to us. Of course, cocaine is another matter, but the cannabis trade, especially because of the current medicinal use, which is increasing so much that it could be a good commercial crop, provided it's well regulated and so on. I can add this idea. I also want to say that even at the international level, so long as, when we talk about the SDGs, for example, so long as there's no mention as such of the issue within the context of decisions which come out, when governments are reporting, they don't feel obliged to even refer to this issue. Maybe, Mohammed, you have worked at the international level for so long, you'll be able to advise us how we can get this whole issue of drugs put high enough so we have even a sentence somewhere, and not just leave it to this kind of discussion, but at the level, all governments report on SDGs and how they are doing. If suddenly they have to report on drugs, of course, they will take the issue more seriously. They will do the necessary scientific work we are doing, we are referring to, and bring out the data, and therefore guide decision making within countries better. I think that as a continent, Africa has been left behind a lot. I think we ourselves will have to take ourselves more seriously so that we can address the international community with really better data, etc., which will enable us to get assistance, especially as it relates to harm reduction. We talk a lot, people suffer, we should do this. There's no capacity. There's no capacity. I think this is where the wagon should be stopping at this point in time. It will help us a lot if everybody will add their voice. And if we could also be able to get maybe a lot more assistance focused on it. When we have said, when you arrest a person with a small user of drugs, don't send them to the police station, send them to the hospital. And there's no facility in the hospital to receive them. Then, of course, we are just talking. We have to link the two, which brings me to the last point I want to make before I get on this particular track. What I'm also realizing, say, in Ghana, is that we do not have trained personnel to handle the implications of harm reduction and treating the whole drug issue with the medical lens we are now calling for. I look even at the doctors who are available to handle people with this particular kind of problem, we find that they are psychiatrists, general psychiatrists. We don't have people who have specialized on treatment in this regard. And what we are finding is that they, instead of helping us, have become a problem. I've listened to a lot of our psychiatrists in the media, reaching out to Ghanaians to say they shouldn't listen to us because they can give evidence that 90% of the people in the psychiatric care are drug addicts. You know, I mean, this is because they're not trained to look out for what happens to people who are sent to them using that particular drug addict barometer. And therefore, we're not just talking about physical facilities. We should also be training specialists who can help us to handle issues of trying to push for handling of this whole topic as a health issue rather than a criminal issue. If I might just stop here.
Well, thank you very much, Dr. Mary. Well, you anticipated the following questions about SDGs and MDGs, because this was the question that I wanted to share with you. We are only 8 years from 2030, and I know that in the African continent we are really lagging behind in terms of so many of these development goals, and the COVID-19 exacerbated more the consequences and the possibility of reaching these goals. In your opinion, do African leaders and decision makers understand the link between drug policies and the sustainable development goals? I think Dr. Mary asked me from my experience why this element was not put as one of the SDGs. Well, we experience a lot of problems adding already the issue of partnership. We wanted to talk about whenever you want to deal with security and security challenges, when you want to talk about food security, when you to talk about conflict, you always need the contribution of the world, of the other partners. So partnership is inherent to each and every goal of the SDGs. And the Charter of the United Nations is calling for cooperation, for development, and for respect of human rights, etc., etc. So we were told that the issue of drugs is a cross-cutting issue. It has links with, for example, with combating poverty or reducing poverty, zero hunger, education, responsible consumption, peace and security, life on the land, etc., etc. What is your say when it comes to the African leaders taking into consideration this link between drugs and the other objective of sustainable development? See, Khalid, since you have been not solicited for about 10 minutes, so we let you some time to breathe and to energize yourself. Please go ahead. You go first, and Mary will follow.
Thank you very much, Mr. Ambassador, and thank you for all these very interesting and important different interventions, and especially on the discussion on the SDGs. I mean, so without going a lot on the history of the SDGs, there is a target 3.5 on the prevention and treatment of dependency and of problematic drug use, but also related to alcohol. It is, as you have said exactly, Dr. Chineri Hassi and Ambassador Lulishki, it is a very technical target that has absolutely no specific data to reach by 2030, for example. There isn't any specific data to reach, and it is very much based on the reporting on the annual reporting questionnaire that member states send back to the UNODC in Vienna, reporting on their data. And we, as we said before, only 11 countries did so for the World Drug Report for 2021 from our African group out of the 54 members. So just to go very briefly on the SDGs, I mean, beyond really being a transformative agenda, they are very different. And as you know, all of you, this is at playing that level field for once, with all countries being together, not the North pulling the South. It is also really about a change of mindset and about the universalism of human rights and values that would need to permeate. So as far as the implementation of the SDGs, it's much, much, much more complicated, of course, than the MDGs, because it's much larger, requests enormous budgets, has been calculated by The Economist, about 4% of the global GDP to achieve the implementation, etc. So it's no longer, and it also happened in a world that became so multipolar, with new emergent powers, with new funding models that exist, with new private-public partnerships. So it's a very, very different world from what it was. Nevertheless, the international community has decided to separate both SDGs from drug control. That was it, for example, with the adoption of the outcome document of the UN General Assembly Special Session in 2016, when the international community adopted this line saying that the Sustainable Development Agenda and the International Drug Control Regime, or the World Drug Problem, as it's called in the UN terminology, are mutually reinforcing. And so they've been kept on two lines. As of the SDGs are about the social soft power tools, while the drug policy remains within that security hard power tool that needs to be responding to crime. And as you said, almost all the SDGs are touched. So of course we have the most important one, and this has permeated through discussion today, the equity, number 10, on justice, of course, criminal justice, number 16, and how you interpret it from a country to another in terms of the implementation. About, of course, the 17, at the target 17 on cooperation and partnerships that you have just spoken about, Mr. Ambassador, on the health, the cities, but of course, again, and it's very important to remind, and I was gonna say here, it is about the gender equality in women, and the number 5 and the impacts on women. But just to finalize, the problem with the using the SDGs framework for drug policy reform is the fact that, as Dr. Baraday was saying and President Motlanthe was saying as well, people who use drugs are considered criminals. So sometimes they even lose their civic rights because of a criminal record or because of a sentence in some countries. And so they can no longer be concerned by this social framework, and they are left behind, and they're even left outside, not only left behind because of a disproportionate response. And so we see today, for example, let's take the example of UNAIDS that sees that its target to end AIDS as a public health epidemic by 2030 is not going to be achievable among people who inject drugs, not because we don't have the technical tools how to do it or the non-existence of harm reduction services, but it is because of the laws and policies that do block it, because of the criminalization and the mindset that is put, as all your excellencies said in the discussion. So I will be pessimistic here, and I'm sorry, and I would say that unless there is a miracle in the coming years, it's very difficult to see that the SDGs will be influencing the drug regime and its implementation, at least from here to 2030, because it is no longer that much on the political agenda, specifically since this global pandemic and the shift in budget, even that existed, those little budget that existed for pilot projects for harm reduction that are also being shifted somewhere else. There is no leading country or no leading political figure that is sitting and that can change now its own policies on the ground and can prove of a comprehensive reform. So even where we have reforms, they're very targeted. So decriminalization through removing criminal liability, but keeping an administrative sanction, or implementing one single harm reduction program, be it needle syringe programs, for example, like Nigeria did, and that's it. So it is very partial discussion. And finally, just to say that countries, even when we get to this discussion at the political level, countries start looking for new mechanisms and new agreements, political agreements, even legally binding ones like regional conventions to address the issue in where they are, whether in West Africa, other places. I mean, the Arab League, for example, and us Arab countries, we have a Arab Convention against illicit trafficking in narcotic drugs and psychotropic substances of 1994. It is in my opinion, thank God, not enforced, but it exists. So this is the solution where countries go directly. They do not go into that of let us take it from a more humane, and that relates very much to the criminalization and the legal status of people. Thank you very much.
Thank you, Sir Khalid. I move to Dr. Mary.
Yes, thank you very much for the floor. And Khalid, that was very helpful. What struck me was the intention, therefore, to treat this whole drug issue within the context of the SDGs as a cross-cutting theme. But what we have realized, again, working within the area of gender, is then you don't have any godfather. You know, there's this person might be dealing with it, that person might be dealing with all the, you know, we need to have champions, especially in West Africa, where you have a problem which is so emotional, which has been a subject of stigma, etc., which would therefore not be something which would normally be discussed at very serious levels as an important topic. I referred to the way in which this particular matter is treated in Ghana as and therefore people really not wanting to be associated and so on. For me, I have gained a lot from our interaction now, because I see that it's not enough to talk to individual leaders. We really have to make champions of some of them. It's extremely important. And also at the level of the African Union, to try to make, to find champions, people who would actually come out and speak at the highest level and show commitment to the topic and help us to drive the process, and therefore to create the change we are asking for. Mentality change is the most difficult thing. And I heard you say, Khalid, it is a mindset. We need a mindset change. It means we have to be working with population. I am confessing that in a country like Ghana, we are on very weak wickets, and we really have to bring out models which can make for real change in the way people look at the issue in the first place. And also to try to link more closely in our own discussions with how it supports each, because that's what we have now, each component of the SDGs where we think drug should be taken seriously. When we say no one should be left behind, leave no one behind. That could be a slogan to get governments to stop abusing the human rights of people who happen to be on drugs. The final word is really to leave the small fry alone and go after those who really are destroying our societies, the barons, the real fish who are swimming away and taking advantage of our poverty situation to get our people locked up because they are the ones who are used, and get caught up in this whole criminalization approach to drugs which we have now. But I want to finish by saying that for us, when we think about the SDGs, we are talking about quality of life. And we have to try to promote whatever is going to yield the kinds of impact, especially in the rural areas, which will help them to improve their way of living, find a way to convince our governments that they could be partners in regard to the decriminalization agenda, because it will be really promoting something which should be close to the hearts, i.e. The fight against poverty, and to take the sector theme area seriously, so that the kinds of regulations, etc., which will make people comfortable with talking about drugs will be what they will be talking at the highest level. I'm proud of the Parliament of Ghana that they had the courage to take us through the laws we pushed, which has made the area a lot more comfortable and a lot more, I might end, sensible. Thank you very much.
Thank you, Dr. Mary. President Motlanthe, please.
Thank you very much. No, I want to concur with Dr. Mary and Khalid, but also to say that we need more involvement of civic society as well, because one of the weaknesses in our governance on the continent emanates from the short-termism that governments tend to try and compact everything in the 5-year term or 4-year term that they have. And some of these issues are long-term issues. The quality of life is a long-term issue where people or communities, particularly in rural areas who relied, for instance, on the cultivation of cannabis, you need, substitute crops to sustain the livelihoods rather than to simply allow big corporates. What is been happening in countries such as Lesotho, down south here, and even in South Africa, we find that major corporations have now come in to produce all manner of byproducts on cannabis, and they are already elbowing out communities who relied, on the cultivation of cannabis for their subsistence. So I agree that this is an issue that needs champions who will be able to ensure that it finds a space on the international agenda, and of course also on the agenda of the AU. So my take is that we need to have champions who will address complacency, because there are two weaknesses in terms of African governance. It's complacency and short-termism. To sustain, these programs, we therefore need champions who will be in a position to always inspire broader involvement in our countries than is the case at this point in time. Let me pause there.
Thank you, President Motlanthe. And my last speaker for the day will be Ustad Mohammed Baradei. Please go ahead, sir.
Yeah.
As we can see, we have a serious problem on our hand. We, the people who know, realize that we have a serious issue. Governments, on the other hand, is going on the wrong direction. I mean, that's the issue we are facing. They are still, it boils down to either repression or human rights. I mean, basically, if I try to put it in the big picture, it's either we leave these people who are unfortunately usually at the bottom level of society to on their own device, just get sick, do not have enough to eat and die, or try to have an inclusive, humane society and pull them up. That is the issue. The challenge, as Mary said, is how to bring it to the front burner, how to make people, government basically, feel that this is an issue where people care about and want a change. That, for example, she mentioned that there is no reporting under the SDGs. Can we find a way that people report under the SDGs? It's essentially a question of equality. Everybody now talks about equality. It's becoming the fashionable word, equality, inequality. But there is nothing more unequal than leaving these people left behind completely in misery. So we can find, if we want, the African, for example, the African Union, or with the cooperation with the Latin American countries, a way to ask, or we at least report on drugs as part of our SDG reporting. So we have to be the change. If we are going to wait for others, they're not going to change for us, frankly. They are not. President Motlanthe mentioned that we need champions. It is true. I mentioned that at the Global Commission, and we said maybe we need some influencers, so to speak. Unfortunately, we need maybe famous artists, famous sports people who will come and say, we need change in the drug issue. I think this is an issue anyway. We're going to discuss at our next meeting on the Global Commission, how to bring this issue to the front burner, how to pressure government to go in the right direction. So we need first to understand that the change will have to come from us and not wait for others to change stuff for us. We have an issue, we have an ethical issue, we have an equality issue, and the ball is in our court. Whether we call it civil society, whether we call it government, we need to change. So at least get the money now that government get for repression, get it for harm reduction, Mary. I mean, we get a lot of money now to repress, to put people in prison for the criminal system. I'd rather at least get this money to help people get clean syringes, to help people get consumption rooms, to help them as human beings. So there's a lot we can do. I mean, I don't think we just should just say, let's wait for others. It's us. Start with people like us. It goes to the African Union. It goes to government. It goes to experts. But we need to be the driver for change. The situation right now is awful. I mean, I should end by saying that. And it's in our conscience that we should not leave these people left behind in such a miserable way.
Ustad Al-Baradei, thank you very much. And I would like, we are about 5 minutes from closing this webinar. And before sharing with you some takeaway elements that I put together, I want, on behalf of our audience, and I have, on behalf of the President, Mr. Karim Al-Ainawi of the Policy Center of the New South, thank you very much for your really high quality and high level debates that you contributed to. It's appreciated. I know that this is a very difficult issue, very controversial, and that the government are shying away from addressing directly the issue. There is a lot of work to be done, and so think tanks, NGOs, and civil society have an extremely important and vital role to play. Now let me, as I said, share with you a few points that I gathered from the different contributions. First, the demonstration has been done that the prohibition and depression and the criminalization approach has failed. Africa is most affected and devastated victim of drug issue. There are governance challenges, there are lack of resources to address the issue. African Union, there is a necessity to shift to a balanced, a holistic, health, human rights oriented approach in which WHO has a pivotal role to play. African Union Plan of Action is a shift, is a signaling a shift, and it is an important step on the right direction, but it needs to be implemented nationally and coordinated regionally, especially in the view of the implementation of the free trade zone, African free trade zone. There will be a lot of people going and goods going and coming, and this is something that will be also challenging. There is a need for leadership champions that will push the issue and that will integrate the civil society and the youth and women in co-constructing any approach to deal with this challenge. We need to listen to the voice of youngsters, women, and vulnerable people, and involve the civil society, as I said. Data-based in our African countries is lacking. We are acting on emotions. We have an emotional approach, as it was emphasized many times. There is stigmatization. In some societies, the issue is completely ignored. It's a taboo. And I think that we have to develop this awareness education is of a paramount importance to raise this awareness and to change the perception of public opinion on this issue. We need to move beyond rhetoric and enact laws and implement them. And we need also to develop a common African policy and try to coordinate, as I said, regionally. We need to change and develop a new narrative, change the way people look to the issue, and as I said, involve them. And finally, we have to promote the awareness of this link that exists between drugs and sustainable development goals for a better quality of life for all Africans. I know I'm the first to know that we did not exhaust all the aspects of this extremely important issue. I'm sure that with the cooperation of the Global Commission, but also with our friends, Khalid, we can continue and improve our thinking and analysis on this issue. Till then, I thank you very much for your participation, and I hope you will keep safe, wishing and hoping earnestly that with the perspective of the borders being open, we can have a meeting where we can not only see each other, but also touch each other.
Okay.
Thank you, Samhan.
Thank you.
Thank you.
Thank you very much.
Thank you very much.
Thank you, Dr. Mary. Thank you.
Thanks.
Bye-bye.